Well, in your health on this Wednesday, we're talking about an illness that we have talked about before, but one that's hitting the community of San Diego especially hard. It's called flesh-eating bacteria. Joining us to talk about this is Dr. Richard Chaffoo. All right, Dr. Chaffoo. We're really talking about this story because a teen in Chula Vista just had his leg amputated.
Yes.
He was playing baseball, and next thing he knows, he's in the hospital, and he's got this flesh-eating bacteria. What are we talking about here?
Well, Jen, you know, since 2010 in San Diego County, there have been almost 170 cases of flesh-eating bacteria, or what we call in the medical field necrotizing fasciitis. I've actually treated several of these myself as a surgeon, and what happens in these situations is there's typically a small break that occurs somewhere on the skin, oftentimes in an extremity, a hand or a foot or an arm, and what happens is that the bacteria then are introduced into that spot, and you know, oftentimes it clears up, but it may go on and the bacteria may get into the deeper tissue called the fascia. The fascia sort of covers over the muscle, the tendons, the bones, and nerves, and can spread relatively rapidly. And so what will happen, Jen, in patients like this is it may be a small or a minor injury that they may forget about it, but then they start having really a significant pain much more severe than you would expect for the type of injury. And that's an early red signal, a hallmark that something really serious is wrong. They may have foul-smelling drainage. There may be air, or what we call crepitus, around that area. And then they'll start having systemic symptoms. They'll have a fever, they'll be sweating, have malaise, chills. And that's a point really early on that you really want to get in to see your physician. This is a true medical and surgical emergency. Patient needs to get treated with aggressive IV fluids, intravenous antibiotic therapy, and of course when you're diagnosed with something like necrotizing fasciitis, it's a surgical emergency because you have dead tissue that's caused by the bacteria proliferating. Many of them will release a toxin or a poison that kills the surrounding tissue, and the problem is the antibiotics, there is an inadequate amount of blood flow to that area, so the antibiotics cannot effectively eradicate the infection, and so you must go in urgently, surgically, and remove the dead tissue, and it can be quite an extensive dissection.
Yeah, and in fact, some of the pictures we can't even show because they're just kind of gross. In fact, a couple years ago, you might remember that 24-year-old girl who lost her hands and her feet and her right leg, and she was ziplining. I want to put up a screen of the symptoms. I know, Dr. Chaffoo, you mentioned them, but I want to get your thoughts on, she was ziplining when she got this, and this teenager in Chula Vista was playing baseball, though they're still investigating how he actually got this. I mean, what are we talking about here? This is not like you're out, you know, in the jungle and you could possibly get this. Are there areas you should avoid, or is it just you happen to have a cut in your skin?
You know, Jen, because it's such an unusual and rare disease, we don't really have a good answer. Certainly, it's more worrisome if you're in a jungle environment because the organisms there are different. But what we see is the soreness like a pulled muscle, the skin gets warm and red looking for blisters or black spots, and that means dead tissue, and temperature changes, fever, chills. And the problem is that, Jen, most commonly necrotizing fasciitis is caused by relatively common bacterial infections like Streptococcus group A, Klebsiella, E. coli. You know, these are organisms that can cause significant infections, but not necessarily life-threatening. We tend to see them more in people that are immunocompromised. For example, a diabetic, someone who is on immunotherapy, has cancer, the extremes of age, but certainly we can see it in very healthy people as well. So you really need to have a very close clinical suspicion. If you have an open wound, you want to get that area treated with an antibiotic ointment and watch it very carefully. If you notice it's spreading, you're starting to get systemic symptoms, it's red, it's really painful, which is the other finding. You want to get in and seek medical attention immediately and not delay that.
Always good advice, Dr. Chaffoo. Great to have you on your show. Unfortunately that we even have to talk about this in the first place, but certainly good information there. Thanks for being here.
Thanks, Jen.